Hi, my name is Jessica, and this is my intramuscular skills video. So first I would gather all my supplies here. I have my 25 gauge needle, my 3 milliliter syringe, my vial, which in this case is going to be my morphine, my alcohol, my gloves, and my pad here, which is going to act as my patient. So first I would begin with verifying the 6 rights: right patient, right drug, right dose, right route, right time, and right documentation. Once I've done that, I will check the MAR. So in my MAR, it has 6 milligrams over 4 mLs of morphine, which when I did my calculation, it comes out to 1.5 milliliters. Okay, so once that is confirmed, I would gather my supplies. I would go to my patient's room. I would knock on my patient's door, shut my patient's door for privacy. I would then hand hygiene. I would go and introduce myself to my patient. I'd say, "Hi, my name is Jessica. I'm here and I will be your nurse for the day." I then would ask my patient for their name and date of birth as their 2 identifiers. "Can you tell me your name and date of birth?" Okay, great. I would check that on their wristband. All right, once my identifiers are identified, I will then hand hygiene and I will put on my clean gloves. Okay, I then would educate my patient. I would say, "Miss Smith," I said, "I'm here today to do your morphine injection. In your case, morphine is a pain reliever, so this is to help with your pain in your leg." Okay, so it's used to treat moderate to severe pain. And there are some common side effects which can include constipation, drowsiness, as well as nausea can occur. If you have any issues breathing, or your heart feels like you're racing, or you feel like you're going to pass out, those are adverse effects. So you need to let me know as soon as possible if they occur. Okay. And in giving this injection, there is 3 different sites, which is the deltoid, the vagus gluteus, and the vastus lateralis. In this case, we're going to do the vastus lateralis. So I have educated my patient. They have chosen their site. I would ask them if they have any questions for me. Okay. I would then get my needle out here. I would open my pack and attach it to my syringe. Okay, I would throw this away. I would verify into the MAR that we have the morphine with the 1.5 ml. So first I'm going to, with the cap on, draw back 1.5 ml. Alright, I'm going to clean my hub of my morphine. I would let that dry. Okay, I can pull the cap off here now. I'm going to inject the air in. Okay, I'm going to flip to invert, making sure that my needle is definitely into my solution. Pushing back up if there's any air bubbles, and I would be withdrawing slowly. So I'm going to come down here to 1.5. Okay. I don't see any air bubbles, but if I did, I would flick the top. Okay, or I would push up and withdraw down to that 1.5 mark. Okay, I'm going to flip this over. I would then pull this straight up and out. Okay, now can't see that again. Let's see. I would do the scoop with the cap here. So I would scoop it and up, press the top on, and then I can show you here my 1.5. My 1.5. Okay. Alright, I would let my patient know that, again, Ms. Smith, when giving this injection, just to remind you that you might feel a little bit of burning and stinging, and that is normal. Okay, so the location that my patient has chosen, I would do for placement, thumb towards the groin, index finger to the iliac spine, and on the thigh, so which would be this area here. Okay, so I am going to clean the area. I first would inspect the area to make sure there's no redness or any edema or any swelling or bruising or any open areas. I then would palpate the area to make sure there's not any masses. Okay, and I would clean the area from the inside out. Okay, I'd dispose of this. Alright, since I capped my needle, I would let my alcohol dry first. Since I capped my needle, I'm gonna have to uncap my needle here. And when I do this injection, I'm going to go slow, and I am going to do it at a 90-degree angle. And yeah, so we can do that here. I'm going to remove the cap. Alright, and with my placement, I'd have my finger and my thumb, and down here like so. I'm going to dart right in the middle, doing it a 90 degree dart motion, straight in. Alright, and I'm going to use my other two fingers to stabilize, and on my non-dominant hand, I'm going to slowly inject my 1.5 mLs of morphine. Okay. Alright, I would get my gauze here, and I'm going to pull it out. Dispose of this straight into my sharps container. I'm going to hold a little bit of pressure here for a couple seconds. and I would check to make sure to see if my patient was bleeding. I then would put a Band-Aid on, but since my patient is not bleeding, we do not need a Band-Aid. Okay, I then would make sure my patient is in the lowest position. I'd give them their call bell. I'd ask them if they needed anything while I was there. I would then remove my gloves, throw them into the trash. I would hand hygiene, and I would go out of my patient's room, shut my patient's door for privacy, and then I would document that I gave Miss Smith her 1.5 ml injection of morphine.